So For All Seasons started almost 40 years ago, and a woman by the name of Joy Price had written a thesis as part of her Master's of Social Work program at the University of Maryland. And the project was to think about something that you could write a paper on and create a system that would fill a gap in the community. And her professor was so taken by the paper that she, along with her professor, and 5 community women, including Karen Kaludis, who was serving in the Caroline County District Attorney's Office at the time, started For All Seasons. And it was created to provide sexual assault and child sexual abuse services to the community. It started in Talbot County, and it then expanded into the 5 counties of the Midshore. And here we are 39 years later. So when we think about Kent County and the services that we've provided, what I say is we were kind of the best kept secret in the county. We've been here for over 25 years. We had a small office off of Washington Avenue, and there was not a lot of people that knew we existed. We've been in the schools for over 17 years. We work in all of the Kent County schools. We've been providing mental health and rape crisis services to the entire community. What has shifted is that over the past 5 years, we've really looked at the trajectory of mental health need and the services that we are providing. And we kicked off a Main Street initiative. It's called Bringing Mental Health to Main Street. And so we've looked at all 5 counties that we serve, and we have decided to bring offices to the main streets of all of our locations, so that when people are driving into town, when the community is spending time in these amazing places that we live, people are seeing that mental health matters, that services are available, that victims don't have to be ashamed, they don't have to hide, that services are available, and ultimately that it is okay to not be doing okay and be wrapped around by the communities that we're serving in. With our new office, we've gone from having 3 offices to now having 9 offices right on High Street. And we've also been able to expand our newest program called Open Access. So for years in our community, in the region, across the state, within our country, people would call for mental health services and be told there was a wait list. And that's, there's more need than there are providers. And that had become kind of a way of life for mental health providers. We made the decision to change the way we were doing business. My philosophy has always been nothing changes if nothing changes. So we needed to make a change. We worked with a national company and hired a consultant. We worked for 2 years to completely revamp the way that we deliver services. And the result was open access. So now we have the ability to have people walk in our office 5 days a week or telehealth in. No wait list for mental health services. You are connected with our psychiatry team within 2 weeks. And it's a way to say to the community, when you need services, we're not going to be on the other end of the phone saying, we'll get back to you in 6 months. And that is what was happening. And so open access gives folks the ability to know that 5 days a week they can walk in, they can hop on a telehealth appointment, and we've been able to expand those services right here in Kent County by expanding the office, adding our administrative team, adding our case managers and the billing department. And the beauty of the Open Access program is that it serves children, adolescents, adults, and seniors. We serve everyone from, I call it our womb to tomb. We serve everyone from a pregnant mom who wants to figure out how to show up to be the kind of parent that she wants to be, to a 95-year-old gentleman as our oldest client. And the beauty of it is all of our services are provided in English and Spanish and over 500 languages by using an app that we have that looks very similar to FaceTime. And all of these services are provided regardless of one's ability to pay. So, maybe there's someone watching that says, I have Medicaid or Medicare, we can serve you. Maybe someone has private insurance, but they're thinking, I can't make the copay. It's too much for me to do that every week. We have financial assistance available so that we can serve community members regardless of financial circumstances. And even for the families who are in between insurance right now. Maybe there's someone listening who is uninsured and doesn't believe that they can come through our doors. That's not the case. We will see you regardless. So we can talk about the four pillars of how we show up in the communities. There's mental health services, so that's therapy. So we're talking about sessions, whether it be individual or family. We do couples therapy. We also have psychiatry, so that's along the lines of medication management, being able to have a psychiatric evaluation. So we work in tandem with those teams. If you are a therapy client at For All Seasons, you have access to the psychiatry team, and that comes in tandem. We also are one of 17 rape crisis centers across the state of Maryland, and we are the only rape crisis center serving the 5 Midshore counties. That means that we have advocates and staff that are working alongside victims. We go and meet folks at the hospital. We will meet folks at law enforcement. We work with our local colleges. We work with our local schools to ensure that when a victim is in need of someone to sit by their side and go through the process of deciding what's next, we are there to provide options. We work with all of our local Department of Social Services. We work with all of our sexual assault response teams across all 5 counties so that we can support the victims who are coming forward, not just in the moment of the crisis, but also with the connection to ongoing therapy and psychiatry services if needed. Our Rape Crisis Center operates 24/7. We have 2 hotlines, one in English, one in Spanish. And so at any time, day or night, if there is a victim in need, we are able to respond. And one of the important parts about the Rape Crisis Center is it doesn't have to be a recent tragedy. It doesn't have to be something that's happened right now. You could be an adult who's watching this and saying, I was molested as a child. We have services for you. These are services that don't know boundaries, and we serve everyone. We have Spanish and English speaking staff right in all of our offices. And we then also have the ability, if there is someone who speaks another language, to bring that FaceTime interpreter right into the session. The other piece of who we've really started to show up in the community as is a center for learning, being able to bring education and outreach to the community. So working with towns to be able to be a part of events that are happening and having a table of information. That's one way that we show up, helping to create programs, speaking to civic organizations, speaking to local colleges and high schools, working with teachers to build curriculum so that as health education curriculums are expanding, we're able to provide expertise for mental health and sexual assault services. We also provide trainings. We work with local businesses. We work within any sector of the community to be able to help people understand how mental health shows up, what's happening in the services that we are providing, and skilling up the professionals that are providing the services. We just held a training last week, the Dare to Lead, Brene Brown's leadership training. I, along with my chief clinical officer, we are certified Dare to Lead trainers. It's helping to skill up leaders and be able to pay attention to what's happening within the employee needs and making sure that leaders have what they need to be able to support their employees. Because we know the reality is that we have to skill up the professionals that are working with folks so that they have the skills and tools necessary to lead a team. Mental health needs across the board are on the rise. What we also know specifically about Kent County is that every county is different. We know that in the 5 counties that we serve, it's like serving 5 different states. While there are some things that go across the board, trauma is present. We know that there's mental health need. We learned through COVID that it isn't always about mental health diagnoses, it's about symptoms. We know that everyone understands what grief, sadness, loss, loneliness, unknown feels like. That was sort of that was leveled on a playing field during COVID. It was the ability for us to be able to think about mental health services differently. It was the ability for us to say, when there is a traumatic event in someone's life, we're here, we're a blanket for the community. And the more that we're talking about mental health, the more that we're having conversations like this, the more that we find that we're not alone. So often we were raised in homes and families where mental health just wasn't discussed. Substance abuse wasn't talked about. And now we're in a time where this younger generation wants to talk about it. And so, think about what the difference could be if we talked about the mental health of our families and our friends as much as we talked about the football scores on Sunday. Not that the scores aren't important, but you would have a whole different conversation. And more times than not, what we find is that when people are engaged in conversation around mental health, there's a sigh and sort of the shoulders come down and someone will say, oh my gosh, I'm not alone. Or you too? I didn't know you had that in your family. When we share our stories, it helps create connection. And we are hardwired for connection as human beings. And so, the mental health story across the 5 counties has some similar threads that run through it, but we also know that rural communities show up differently. So our agency has to show up differently. It's our job to come not to the communities and say, here's what you need, but to say, how can we support you? And so we've done that with Kent County Schools. We're working very closely with the administration. We've been able to receive some funding to enhance the programming in the school. The United Way has been extremely instrumental over the years in helping us with our school-based services. And we work, with state and federal funding as well to make sure that we can be doing the work that is saving human lives. For me, every time I have this conversation with people, it's about remembering to reach out to someone, that we don't have to go at this alone, that there's an opportunity for us to send a text, to send a card, to pick up the phone and say, hey, I'm thinking about you. We never know what people are bringing through the doors. And it's just important as a community in times where there's unknowns in front of us or in times where families are struggling differently, that we create a blanket of support around them. So just a gentle reminder for everybody to reach out and just check in on someone. And if you yourself are the person who's needing the checking in on, reach out to our office. We are here and we are available 24/7 with our hotlines. And again, those walk-in appointments for mental health, there's no wait because mental health needs to be a priority.